You are watching the Doctalk show.
Welcome back. Before we went for the break, we understood the role of sunshine in maintaining bone health. The sunlight helps to activate vitamin D, which is within your body, but it's in its inactive form. When it becomes activated, it helps to absorb calcium from the diet, from the food that you eat. And this calcium is important, is very essential to maintain the integrity of your bones. So we want to learn if there could be other factors that would promote osteoporosis or weakened bones. Dr. Tito, other than diet and exposure to sunlight and age and sex, could there be other factors that would play a role in promoting osteoporosis?
Okay, thank you, Darius. There is also an important element, or what we call exercise.
Okay.
So lack of exercise, it is within the sedentary group of risk factors. Lack of exercise, first of all, makes someone fat, obese, overweight. And when you are overweight, that means you are straining the bones. Because remember, the bones now are like the machine which carries you.
They support the
support
body.
structure.
Okay.
And if you overload it, it's like similar to when you overload a boda or when you overload
The
a
vehicle,
car.
and then it starts getting problems.
Lack of exercise. And when we exercise, we keep all our structures healthy. Not only the bones, but even the muscles. The muscles are strong. Not only the muscles, including even our brain. When we exercise, there's better blood flow in the brain. We think better. Not only that, every aspect of our body benefits from exercise.
Okay, so exercise plays an important role in improving the health of bones.
Exactly.
Okay, so what is the role of liver and kidney disease?
Okay, so those two organs, the kidneys, which are two in our body, right and left, and the liver, which is one, big one, which has different lobes. They're very, very, very vital organs of our body in storing the vitamin D, and also in the absorption and resorption of calcium in our body, in the digestive system. Substance abuse like alcohol. We know alcohol, excessive alcohol over a longer time also damages the liver.
Okay.
Okay, we see our friends in the rural areas who take too much waraji. They end up becoming like kwashiorkor, yellowing of the skin, losing the hair, protruding belly, and finally they many times die of liver cirrhosis. Substance abuse, also excessive smoking is another problem. And then, of course, these other new drugs on the market, cocaine, marijuana, they all
illicit drugs.
Illicit drugs, they also damage our liver and the other organs.
Okay, so people should be cautious of what they do. This drinking a lot in the bars, all that is indirectly contributing to the poor health of bones.
Exactly.
Okay, so how can one tell that their bones are becoming weak?
Okay, so what we can call the signs and the symptoms. The most common sign is pain, body pain, usually back pain. And in our hospitals, orthopedic clinics, the most common complaint patients come to see us is backache. Backache, and average, all these patients are 60 years and above. So when the bones become soft, they get small fractures, can call microfractures, not necessarily following accidents, simple falling in the bathroom, falling in the room, where they are walking, when they are traveling in bumpy roads. So they complain of backache. It's the most common symptom, most common problem which patients come complaining to us about. But apart from the backache and the limb, leg pains, the worst one is fractures, breakage of the bones, which not necessarily would have happened if the bones were healthy. In medical terms, we call those pathological fractures. In other words, a fracture happening in an already weakened bone.
Those are some of the common signs and symptoms, the bone pains, the fractures, and as you see, as people grow older, they start bending a lot.
Exactly.
Is that also another sign of osteoporosis?
Exactly. At an average age of 35, 40, we usually stand upright, and that's when we have our maximum height. But as we grow older, people who are above 60, they start to bend or to adopt a stooping gait. That is a result of the bones of the back. When they get softer and softer, they lose their height. They become shorter, smaller, and the back is the one which determines our height. And by the time someone is in the 90s, 80s, usually they even walk with a stick. So a stooping gait or even losing our height is also another sign of osteoporosis.
Can osteoporosis occur in children?
Yes, now this is a different type of soft bones in children, which results in their legs getting bent, what we call rickets. And it's either dietary, that these children are missing some of these foods which are rich in calcium, or it is also common in the countries where they have winter. Rickets is very common in Europe, very common in countries which have winter. Imagine when this baby is born in winter. Winter is very cold and people don't enjoy getting out of their houses. So the kids lack exposure to the sunshine. But that real rickets in Africa is less common because our children, they are always playing outside. We don't have winter. Now,
so there's limited exposure to the sun.
Exactly.
In
You'll
the
see
other
more
countries.
rickets in the cool, cold, temperate countries compared to Africa.
Yeah, but you also mentioned diet being important.
Exactly.
So we suffer a lot from malnutrition in Africa, so that could be a potential source of rickets. So for children, they may not get back pains, but they will get bent legs or bow legs.
Bow legs.
So that's one way to identify that the child may be getting weak bones. If someone gets these problems, what should they do when they start getting these back pains? They've gotten a fracture. What happens?
Certainly, the advice is to visit health workers, to see the doctor. Start with seeing the general practitioner from the nearest health unit, a clinic, health center or a hospital. And normally, they will treat the symptom of pain. And you are giving you painkillers. Maybe if the back is bending, give you a support to support the back, what we call a corset. But when you go higher to see a specialist, special orthopedic surgeons, and then they will also try to find out the cause. We'll do blood tests, we'll do x-rays, we'll do investigations, CT scans, MRIs, to come down to the bottom of the problem.
The actual cause of the problem.
If we find the actual cause is maybe dietary, we'll advise you to take the right diet. If we find the actual cause is also hormones. Hormones can cause this. We have a hormone called the parathyroid hormone. The parathyroid hormone promotes bone destruction, bone loss. Thyroid hormone, also hypothyroidism can lead to bone loss. And also in females, when the estrogen is less, that means it can also lead to osteoporosis. They may prescribe you estrogen supplements. And more important is to prevent fractures which would happen. And if they have happened, to treat the fractures.
When we come back after the break, we shall focus more on preventing osteoporosis. Osteoporosis can be prevented. We have learned that it is a natural process of bone destruction overriding bone formation. However, there are some ways you can slow down the process of bone destruction. Don't go away. Stay tuned to The Doctalk Show.
You are watching the Doctalk Show.